Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar, and then undergo the surgery. And after the surgery, to aid in wound healing, also in for recovery, she can continue the capsule.
I can safely say this, all 𝘗𝘳𝘰 products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We're always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So, sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulite siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si 𝘚𝘯𝘰𝘮𝘦𝘀𝘚, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At 𝘚𝘯𝘰𝘮𝘦, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Good evening, everyone. Welcome to another episode of Simply Healed webinar. I'm Sheila, your host, and we are glad to have you with us tonight. Today, we're diving into real science-based solutions for better health. To quickly recap last week's webinar, we tackled a powerful topic entitled The Role of Sugar in Cancer. It was truly an insightful session filled with meaningful questions that our experts well addressed with clarity and care. Now, this week, we shift our attention to a profoundly important topic entitled Childhood Cancer Management, Understanding Multifactorial Solutions. Now, this topic tonight is, of course, very close to my heart because when my son was first diagnosed with cancer, it felt as though the world has collapsed beneath me. And as a mother, I was gripped with fear and questions. But in the middle of that storm, we found courage as a family to take each step forward. Well, our journey taught me that childhood cancer management is never about one solution alone. It requires many working together. Yes, treatment like chemotherapy and surgery are critical, but so are good nutrition to strengthen the body emotionally, to support and to lift the spirit. Family love to sustain courage, and careful monitoring for long-term growth. Each of this is a piece of a puzzle, and together they form a complete approach to healing. There were times when I saw my son weak and weary, and my heart really broke. But there are also moments when he smiled and ate with appetite and played with joy. That's during the middle of the cancer journey. And those moments reminded me that cancer does not have the final word. And today, by God's grace, I'm so thankful to share that my son is now a cancer survivor, doing well in school and living the life of a healthy, happy child. Thank you, Lord. Now, at the onset of our journey, we came across Simply Nature. We also found natural support that made a difference because Simply Nature PPARS is not just a cure, but they help my son regain energy, restore his appetite, and support his immune system during the toughest times. Now, backed by research and trusted by doctors, PPARS became one of the puzzle pieces that supported him through the treatment. And by supporting the gene regulators during the cancer journey, PPARS was able to help restore the balance in body, encourage damage or cancerous cells to stop multiplying, and creates a less favorable environment for cancer to thrive. So, as we discuss multifactorial solutions in childhood cancer management tonight, I hope that today's topic magnifies encouragement that survival and healing are possible with medicine, nutrition, emotional support, family love, and immune support, that every child deserves the chance not just to fight cancer, but to live, learn, and dream again. Now, the intention of tonight's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you all in your journeys. So without further ado, let's dive right in. Leading tonight's AMA is a highly respected health expert. He is a successful entrepreneur and seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International and a PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila. Good evening, everyone. All right. So today's topic is about pediatric cancer. Sheila, I just wanted to maybe start the conversation with you before we answer any questions. What was the greatest challenge for you and your husband? Having Dominic at that time, he was 4 years old, right? What was the most difficult thing throughout the whole journey?
It was really the onset, sir. You saw us.
Yeah.
Time we were.
Also, when I met you, how long? Because when I met you, honestly, when I met Sheila, it was very shocking. Honestly, very shocking because Don carried Dominic in his arms walking into our office, and it was the first time I came across a child cancer patient that looked like that. Dominic was really skin and bones. I mean, really skin and bones. If you've ever seen pictures of like Ethiopia, I think those who are born in the Gen Zs probably have never seen a picture of Ethiopian kids starving. But I think Sheila, you should have when you were young, right? So Dominic really looked like that. He did have a bloated stomach, but he was really thin. So it was so jarring that immediately I looked back at my wife, and before Sheila even said anything, Dawn had said anything, actually me and my wife already decided we were gonna help Dominic. So it was very surprising. So how long has it been that Dominic was diagnosed when we met actually?
I think I believe because we met around October,
Mm.
just before. That was the first time that we met. But the first time that Dominic tried the PPARS was the
Yeah,
day
but how
before
long
the
when we met in August, how long had Dominic been diagnosed with cancer?
a month.
Wow, you mean in a month he became like skin and bones?
Yes, that is actually one
Wow,
of
that must have been
deciding
that must have
factor.
scared you quite a lot, right? In a month, your child. I mean, can we flash the picture up of Dominic again? Um,
Mom, baby, can we?
yeah, baby. All right. Yes, we actually the person handling the technicals today, her name is Baby. All right. She's actually the baby of our company too. She's the youngest now, right? She still is the youngest, right? Okay. Yeah, so yeah, let's take no, this is a picture before. No, before. Do we have an earlier picture? This is Dominic doing well already.
But the one that the picture, I'm sorry, but the picture that was included here, the one that he was
These are already okay. Here, Dominic is doing very well, guys. So
Mhm.
you have no idea when I first met him. Early pictures. I think there was a picture of him from the back. We don't see the front. That one you can tell how skinny he was, and already that was already an improvement. So yeah, Dominic was. So within a month, he became like skeleton. Wow, was that shocking to you?
It was very shocking. It was very abrupt. I think the biopsy took
Yeah, this picture you guys can see. Here already Dominic is doing well. So can you imagine much worse than this, right? Much worse than this, yeah. Okay.
Yeah. So like I said, it's really the onset that took a toll in his health. It was very fast. Like right after the biopsy, I think uh his body really deteriorated already. And and a month after that, that's when the time that you saw us.
Now,
And that's also
so can I ask you, I mean, this is also for the benefit of our viewers today. What was your resistance to chemotherapy? Because I think you went to an integrative doctor. So everyone, she went to Dr. Maddie, who has a very thriving integrative clinic. Actually, I think three locations right now. Doc Maddie is a full-fledged medical doctor, all right? So she was actually a doctor who was serving in the ER, emergency room. She's also an emergency room doctor. So she's very calm, very cool, and a very good doctor. So what Dr. Maddie's journey is that her dad actually had a medical condition, and everything she learned in med school couldn't help her dad, right? Couldn't help her father. So out of desperation, like you tried every drug, you tried everything you learned in med school, and she's an ER specialist, right? You tried everything and nothing's working. So she didn't give up. She's a forever student in the sense that even up to today, she's still going to learn new things, right? So at that point, she went beyond her traditional conventional medicine and went to explore other ways to help her father. So she was able to find a solution outside of conventional drugs. So again, her background, Dr. Maddie is actually a conventional doctor, ER specialist actually. So very credible, very competent doctor. And her growth into integrative medicine was because she couldn't find a solution for her loved ones. In fact, almost all the medical doctors that go into integrative medicine, I wouldn't say almost all, I would say at least 70% of those that I know is because someone in their family, they couldn't treat with conventional. So it forced them to look beyond what they studied and what they were practicing. And then they end up becoming integrative doctors. So when you saw Doc Maddie, what did she? You were okay. Why were you not wanting to do chemotherapy? I mean, so that I'm sure your reason will be the same as many of our viewers.
Yes, that is actually
Okay,
the
so what was on your mind? Why no chemotherapy?
it was I thought he was just a little boy. He was very fragile, and I know the side effects of chemotherapy. I'm so afraid that for him to face.
Why did you know the side effects of chemotherapy? Did you do research or was it just hearsay?
We did some research, of course,
Okay.
and of course, and also a little bit of hearsay.
Definitely, right?
Yes, yes, but that is
What?
actually the.
So what did Doc Maddie tell you? You went to Doc Maddie hoping that there will be some natural
Exactly.
solution, right?
Exactly.
Yeah, that's why you went to an integrative doctor. And
I was hoping for her to say, "Yeah, you know what? I have another option for you, so your son wouldn't go for chemotherapy." But when she saw Dominic's or my son's documents and laboratory results, she actually is the one who begged me, you really have to go for chemotherapy.
okay, so I want to take the opportunity to speak to everyone here. When in Simply Nature, we provide a natural solution to battling and supporting cancer, right? So normally I think our customer service will be careful in what we say, that we can support and help cancer. For anyone to say they can treat cancer or cure cancer and they never even look at your medical reports, I think you have to be careful, right? If they don't even understand the medical reports, and then so unless they are TCM, the TCM, the traditional Chinese medicine doctors that I know today also look at conventional diagnosis. All right. In fact, one of the top TCMs has those X-ray readers right beside his table, that I know of. So they also use Western diagnostics. And when I studied TCM, I had to study pathology and anatomy and all that, conventional science, also conventional medicine also. So again, to anyone who's fighting cancer or any illnesses, be careful if someone says they can treat your disease, but they don't even look at basic diagnostics. Okay, so that is always helpful and important. Right, so that's usually one thing I'll look at. Okay, so Dr. Maddie said that must go for chemo. Were you shocked? Why is an integrative, and she doesn't sell chemo, right? She doesn't do chemo in her clinic.
She doesn't.
Yeah, so it's not to her interest. She makes nothing from you if you go for chemotherapy.
She has a lot of other modalities that she can offer to us, but still she insisted and begged me to go for chemotherapy.
So this is wonderful. This is why we love Doc Maddie, because she's actually doctor first. So she knew what was most important for a patient. It's not advocacy. Sometimes we meet many people who are advocacy first. That means they advocate for natural, regardless of the condition, regardless of the patient's condition, right? Because they so believe in natural and only natural. So I think for healers, it should be the patient first. So in this case, Doc Maddie actually, in her professional capacity, feels that chemotherapy is something he must go for. And so then after that, the long story short, we supported Dominic through chemotherapy with Simply Nature Liquid, and he's totally in remission for those of you who just joined us. So now I just want to ask you, throughout the entire journey, what was the most difficult thing that you went through as a parent? Yeah. And what was most difficult for Dominic as a patient?
As a patient, once again, it's actually the onset sessions.
The first few sessions.
It's where you can say the ultimate kickstart of the chemotherapy, where you can really feel all the side effects and the nausea, the vomiting. We've seen it. The thing is, so since we saw it in the first session, we were expecting it throughout the other next sessions of his chemotherapy, despite being not that we believe in, because we were already using PPARS at the onset. Okay, but still we saw that, and then after a few sessions, we were expecting him to be nauseous. We were expecting him to vomit. I even brought a tabo, in one of our confinements. But thankfully, I was amazed that we didn't need the tambo anymore. And he was playing, even though the chemotherapy was, being administered to his body. So
Wow.
exactly. So that's why I was very encouraged when I saw the effect on him. Of course, it is very difficult as a mother. I've always thought that, it should have been, the parents who are going through that, but we were
Guys, yeah, sorry to interrupt you. Guys, I just wanted to show you because can I have a share screen? Yeah, can I be able to share
I
screen?
think, sir, yes, you can.
Yeah. Okay, those of you who find what we're talking about interesting, please just say yes or type in, or else if not, I'll move straight into the AMA session already. All right, I just thought that since Dr. Jansen is not with us today, I can share a bit more, some real life
Miss you,
experience.
Doc Jansen. We
Huh?
miss
Yeah,
you.
we missed you, Doctor. Okay, so this is Dominic. You guys can see. Is it showing on the
Yeah.
Facebook screen? All right. Okay, this is Dominic, guys. You can see what I meant. This is Dominic when he first started, before his first session of chemotherapy. So this is not the result of chemotherapy. This is the result of the cancer. So Sheila, Dominic had 4th stage nasopharyngeal.
Correct, yes.
Yeah,
Rhabdomyolysis.
which is nose cancer, right? Nose. So what's so dangerous about this, everyone, is that nose cancer, the tumor can grow into the brain because it's in the nose, right? So it grows backwards. So it can push into the brain. It can make the patient blind. It can affect many things, right? Because it's pushing into the brain. Okay, so this is Dominic before chemotherapy. So many people think this is a result of chemotherapy. No, this is even before chemotherapy. All right. And this is Dominic after 2 weeks after the first session of chemotherapy. So you can see he looks so much better, right? So here is were you shocked, Sheila, when Dominic looked like this and then after chemotherapy? I think Sheila, like most parents, thinks that if my son looks like this going for chemotherapy, he might not make it, right? Were you surprised that after chemotherapy he actually looked like this?
You'll be more amazed. If you go back to the first picture, you see
Yeah,
the nodule on his neck was actually
yeah,
really
yeah,
showing.
here, right?
It's quite evident already. And
Yeah,
it's starting to show also on the other side.
yeah.
But after the session of chemotherapy, as you notice, it's very not visible anymore.
Yeah, it's amazing, right? Amazing. So I
Yeah.
just want to share with you guys how effective Simply Nature Pipa liquid is to help a patient undergoing chemotherapy. So of course today, although we're talking about pediatric cancer, the chemotherapy drugs that a child use, this is a heart tumor. So I think definitely anybody with a heart tumor, that means there's actually a tumor, all right? So the other type of cancer that does not have tumor are, for example, bone cancer and blood cancer, leukemia. There's no tumor. So for those that have tumor, usually they have chemotherapy. They will include platinum-based chemotherapy drugs like cisplatin and oxaliplatin. So I'm sure Dominic's cancer cocktail does include one of the two, either cisplatin or oxaliplatin. And then after many 38 sessions, 38 guys, adults only do about 8, 12. A child has to do 38. Now, if you want to know why 38, because children are growing, which means they have all these growth hormones that help them grow very quickly, right? You notice when your child is 4 years old, 5 years old, 6 years old, how fast they grow out of their clothes. So you can imagine all these growth hormones will also help the cancer to grow. That's why the treatment for kids are also very aggressive. Okay. And Sheila, I don't know whether Dawn told you this. When I visited you and Dominic at PGH, number one, I was really shocked at the condition of PGH. Okay, I went there at night. It really looked terrible. Like if you're not sick, you go there, you end up being sick. Back then it was, okay, guys, I'm not saying anything bad about PGH. Okay, it's just that it's a very old hospital, Philippine General Hospital, and that wing was just, I think it's all renovated now. But back then it was just pretty scary lang. Honestly, I was very shocked. Anyway, I was walking with Dawn. I asked Dawn, how many of his cohorts are still alive? Like how many of the cancer kids that went in for treatment? So Don told me only about half. Is that your feel as well? I mean, as a parent, you went in and you saw the other cancer kids also going through treatment, right? What would you say is the survival rate based on
Almost around that figure as well, sir.
like half, right? About half didn't make it. Okay, again, we're not talking about the survival rate of pediatric children because during this time, these are actually at a general hospital, right? So these are the ones that come from the province and they are also be usually financially very difficult. So they also live in not ideal environments. Many of the parents of the kids that actually sleep on the road or don't have anywhere to sleep because they're receiving free treatment at the hospital. All right, so that's the condition the children have to go back to after they leave the hospital also. So that might affect the survival rate. But anyway, this is Dominic after 38 sessions. All right, and then this is Dominic, and he is plump now. I think there's a more recent picture of him from baby side. He is plump now, and is I would say maybe a little bit fat.
A little bit.
Okay, and he's doing very well in school. So I just want to share with you guys that even that's a wonderful success story. Okay, so what's the greatest challenge for Dominic? Was he ever reluctant to go for chemotherapy? Did he say, "Mommy, I don't want anymore. I can't take it"? Was it painful? Anything?
The fact that you are there's part of the procedure that they have to inject a very huge needle at the back in the spinal part.
Wow, I didn't know that. Okay.
And he has to endure that.
Oh, it's very painful.
He has anesthesia, of course, but
Ah,
he has to endure those kinds of procedures.
uh,
And the once in a while visit, of course, they have to
mm.
put a lock, and they tried. If they fail, they have to try again to start
Okay, wow.
again. So, but Sir Sean, it's not only those. Those are actually a common thing. But I think what really hurt my heart when we were doing the chemo session was, other kids are crying at night because
Crying,
they are
painful.
they are really in pain.
Oh, wow. Okay, you can see Sheila's a bit emotional right now. I think remembering those, but the good news is everything, I like what the Bible verse says, right? God makes all things beautiful in his time. So things are wonderful for you and your family right now. Which is why I think for Sheila, doing Simply Nature is also like a mission. You went through it, you know how difficult it is. You wouldn't want other people to lose their loved ones to this cancer.
Definitely, definitely.
Yeah. Okay. So Dominic as well. So since let's go into questions. Right. So this is just a glimpse for those of you who are regular viewers, right? That we do this program because we have my dad is a two-time throat cancer survivor. All right. So we've all I can safely say that, and then our customer service, right? Like Daisy, her mom was had gone through cancer. So this is something that has touched our lives in very real way, right? I remember so for all the cancer patients out there, I really understand all your concerns. I remember the third time my father had a cancer scare, third time, right? So, since he had fought two times already, it was not the death thing that was actually straight on our minds. I just want to share with everybody so that you guys know what we mean by we understand what. What's the first thing that came to my mind? I went to meet my dad and I said to my dad, "How do you want to fight this?" Because truthfully, as children, we were also afraid of the cost, the medical cost. All right. But of course, we love our dad and we are prepared. So I just wanted to also prepare myself. So I wanted to ask my dad, how do you want to fight this? My dad actually, in his wisdom, he told us, son, I don't need you to spend a lot of money trying to cure me of cancer. I just don't want to be in pain. At that time, my dad was about 70 already, 70 years old. So he said, my best days are behind me. You guys are all married. I would like to see my grandson get married, but it's not super critical. All right. She said most important is that he didn't want her to suffer. He didn't want to suffer. And he told us he didn't want us to spend the millions of pesos that would cost us here. In Singapore, it's even more expensive, right? It'll cost to fight cancer properly. So yeah, I just want to share with you. I also understand how scary it is financially when someone you love has cancer, because it's not a cheap disease to fight. It's a very expensive disease to fight. So on this program, I went through that part of like, okay, and I braced myself and my siblings. We were already okay. How many millions? You must prepare how many million? I must prepare how many million? And we had to tighten our budget, and we are ready. But I would say my dad freed us from that worry, and thank God it was a cancer scare. He did not have a second relapse, all right? So it was fine. So everything was fine. But I just want to share with you, before we even did the biopsy to confirm, we already start to talk about how are we going to strategize, how we're going to approach it. And I hope that helps everybody. Yeah, so let's go to our Q&A.
Yeah, before we go to Q&A, I just, of course, want to first say thank you, of course, to Simply Nature. And I just, it's not because I'm part of Simply Nature. You adopted me as part of the customer service. But truly, from the bottom of my heart, I'm very thankful and blessed that I have came across Simply Nature at the onset of the journey. It would have been different. Without PPARS in it. So thank you.
Yeah, actually, Daisy was just sharing that. I think Daisy said before she wished she encountered us. Now Daisy is with Simply Nature, but her mom has returned to the Lord, right? So she, in a way, also find it very. She was speaking, right, about how rewarding she felt that she was able to help cancer patients. Now, have an option that her mom did not have. Yeah.
Exactly. Thank you, sir. All right. So okay,
Let's go to the questions. All right. Yeah.
Okay, for our first question coming from is like Cabiso. My nephew is diagnosed with leukemia. Are there any signs we should look for that might suggest the cancer is getting better or worse? Would you like this one?
This one for leukemia, you just have you have to go back to your uncle to do the tests, right? I can share with you that leukemia, go for chemotherapy. Chemotherapy is actually effective for leukemia, and whatever oncological protocols right now, it is actually effective for leukemia. All right, the only thing is you have to support yourself through that process, which means you have to protect your organs through that process. So far, we have had very good results with Simply Nature liquid extract as a protection. The thing with cancer, like I just spoke to a friend, a cousin of mine, and he was just saying in his, no, not cousin, my brother. It was very confusing. I've been speaking to so many family members recently. My brother was just sharing with me, he had a second friend whose dad succumbed to pancreatic cancer. So he was just saying that the cancer was not obvious, right? So why am I saying pancreatic cancer and leukemia? Because they both share something. You cannot see the lumps. It comes as a surprise. There's no visible thing. It's not like breast cancer. You shower, then you feel, oh, what's this here, right? The pancreas is inside. And he said that the friend's dad was actually super healthy. But the moment he was diagnosed with pancreatic cancer, 60 days. And that's all it took. And the deterioration was very, very rapid. And so what I'm just saying is that for leukemia, yeah, make sure you work with your oncologist, all right? And what we can do on Simply Nature side is to make sure that as we support you through your chemotherapy, you're feeling strong, okay? On our side, the physical manifestation that you should be able to feel is that your life doesn't change that much for you. Okay, you can still walk and eat and feel strong. Your mood is okay. Because when you take chemotherapy, it affects moods. If it disrupts your your GI, it will definitely affect your mood and things like that. Okay, so for Simply Nature, when it comes to cancer, when we support oncological protocols, our key performance is that we want to see that the patient is strong and healthy.
Definitely.
So unlike tumors, you can't actually see your lumps grow smaller. Okay, that's the thing with leukemia. So you have to go for your diagnostics.
Agree. Actually, sir, I just want to share a little bit.
Yeah, go ahead.
In comparison to solid tumor kind of chemotherapy, with leukemia, it's quite long, like lengthy chemotherapy sessions. But there
Yeah.
are periods that they will be resting and then go back again to different sessions. But I agree with you. Once you have already started with chemotherapy session, you may want to have the PPARS alongside the treatment so that you'll stay as energetic as you are and your immune system won't drop. That's what's important during this
Yeah. So leukemia is problematic because your blood is your primary immune system. Okay. So what do we mean by we say our blood is our primary immune system? Literally, white blood cells, red blood cells, first of all, they function to carry nutrients. They also function to carry other things throughout your body, right? So which are part of your immune system. And blood cells, there are many types of blood cells. Alright, so we say it simply red blood cell, white blood cell, but there are actually many types of blood cells. And just to keep it simple, what leukemia is that your blood cell doesn't grow into the proper blood cell. So you are lacking so your immune system itself, which is your blood, is actually compromised. So when you have leukemia, it's actually affecting your own immune system ability, right? So it is important to support your blood cell delineation or differentiation. So this is what PPARS does, helps to keep your red blood cell count up, helps your blood to form correctly. So leukemia is mutated blood cells, or simply your blood cells are not maturing, so you never have the correct blood cells in your body. All right. So yeah, like Sheila said, the procedure could be very long, and you want to be able to last the whole process. So for all chemotherapy, you must finish the cycles. So if you don't finish the cycles, yeah, it's you have to aim to finish all the cycles. So you need to be strong enough to finish all the cycles for it to be effective.
And of course, it lessens the chances of recurrence as well if you finish everything. So next one coming from Mr. Liam, thrown to us privately. So how?
I hope that, sorry to the viewer, I hope this helps because can you ask her question again?
Okay. The question earlier was, my nephew is diagnosed with leukemia. Are there any signs we should look for that might suggest the cancer is getting better over?
Okay, really the only way is diagnostics, right? So physically you can't tell. Of course, fever stop, no more bruising or bleeding. The simple one is when you do the diagnostics, the blood cell count actually goes up. Okay, so these are the common things, but they all require diagnostics. So you have to do the blood test in order to know. And leukemia is the most common pediatric cancer, if I'm not wrong, or the top two. Okay, and the success rate for treating children with leukemia is also very positive. Okay, so be confident. The only thing that stops it is if they are not able to complete the treatment. That means if, for example, when a kid is allergic or not reacting well with the chemo, so some kids, they go through the chemo, it's fine, they can take it. Some kids, they are more sensitive to it. So the chemo definitely works. The treatment really works. Now, the other thing is, can the child go through it without any severe side effects? So that depends on child by child basis. So this is where Simply Nature PPAR Liquid can really come in to help to make sure that your nephew actually goes through the whole process strong and healthy. And you can see from the pictures in the beginning of our program how Dominic actually became better looking, put on weight after going for his treatments. Yeah. Okay, next question.
The next question coming from Miss Hannah, is it advisable to take PPAR supplements during okay, this is interesting, during perimenopause to ease hot flashes and mood swings?
Okay, the general answer is yes. The specific answer is I can't answer. I'm not too sure because I don't deal with menopausal patients that much. Okay, mood swings. Yes, because you go through menopause, so there are hormonal changes also. However, Simply Nature PPARS also helps with hormonal balance as well. So one thing it does is, for example, increases serotonin production. I tell you one very interesting one. We had a client who took PPARS for diabetes. All right. We did not know this person was also suffering from severe depression, and he was taking Prozac. Prozac is to make him feel happy, right? After taking PPARS, he stopped taking Prozac because he felt happier without Prozac, without needing the Prozac. Okay, why? The Simply Nature PPARS helps the body regulate its metabolic functions, anti-inflammatory. So every emotional, you will notice when you are stressed, when you're feeling depressed, right? You get sick easier, right? One reason is because there's chronic inflammation that weakens you. Another thing is that any brain disorders, so any depression and all that, one of the root contributors to any brain disorders is neural inflammation. That means inflammation of the brain, all right? So Simply Nature PPARS is able to help the body modulate that to bring down the inflammation. So when you bring down the inflammation, it helps, okay? Next example is kids who are ADHD, autistic children. They calm down when they take Simply Nature PPAR tablets, not even the extracts, okay? So for you, I would seriously just suggest the tablets, okay? Why? As you go through menopause, your body is going through a lot of changes as well. If you are going through menopause, that means you are at that particular age. It's also the age that is very important to watch all your blood sugar, blood cholesterol, all that. So the tablets are fantastic in helping you with these basic metabolic syndromes. So it's one of the best supplements you can take during this time. And then let us know how it helps you in terms of your mood as well. Okay. So, women also worry about things like osteoporosis as you go through menopause. There are hot flashes and all that. So a lot of that is because your body's chemistry is changing. So Simply Nature PPARS, the tablets, again, don't need to even do the soft gel capsules. The tablets will really help your body modulate your metabolic pathways, and that will help a lot as you go through this period of change and transition. Right now, does it help specifically with hormonal? I will have to do a little bit of research on that. That's not an area I'm super familiar with, but I think I've given you enough reasons to say that this is one of the best supplements you can take. So again, it helps with the calcium uptake as well. There was a doctor who prescribed Simply Nature PPAR tablets for lactation. Which I was like, I was shocked. How does this help produce milk, right, for a mom? So he was just sharing with me, for a mother to produce milk, the level of calcium in their body has to be healthy. So he was prescribing tablets for calcium uptake. So the calcium found in natural plant supplements like Simply Nature is chelated. Okay, so to help you understand this, if you need iron in your body, you cannot take a nail and swallow the nail. All right. Okay. So you can't shave the iron nail, the filing, and then you eat it. You intrinsically know that's going to be poisonous and not good for you. So how do we eat iron? How do we eat calcium? You can't take seashells, grind it up, and then swallow the seashell, say, oh, rich in calcium, right? Although I know some old people will tell you to chew the bones of the fish, right? And rich in calcium, things like that. Okay, so our body doesn't really absorb calcium and minerals this way. It needs to be chelated. So this is what happens, right? The plant eats or sucks up minerals from the ground. right? And it combines it, the process of chelation with an organic part so that it can be then absorbed into the body. All right, so that's why we cannot eat a calcium powder. All right, you eat calcium has to be chelated. It has to be in a form that is processed in a way, but naturally, right? Chemically, I wouldn't say naturally. It has to form certain bonds for it to then be absorbed by your body. Okay, so when you take, for example, like if I wish Dr. Jansen was here. What plant is rich in calcium? Is it spinach? Spinach is iron, right? So those plants the iron is chelated. So the minerals that you want should be in plant form, where it's chelated, then your body can absorb it. Okay, your body can absorb it. Just because there's calcium in the milk doesn't mean it can be readily absorbed by your body the same way as the same calcium in a plant. Okay, so yeah, it's different. Okay, so yeah, tablets alone should help you. How much should you take? Try and start with 10 micro tablets 2 times a day. Okay, before food. Before food means 45 minutes. If you already eaten breakfast, it's okay, just eat it. Better to eat than not to eat. Okay, it's just that we want to do best absorption, right? Okay, and then come and give feedback to the CSO customer service that takes care of you. Let them know after taking the PPAR tablets, after your first bottle, how do you feel? Okay. Some of the things that you can look out for is should feel happier. Okay, maybe less bloated, more energy level. And then just give us a feedback. Because every client, every patient goes through different experiences when they go through menopause, right? So tell us how it helps you. So that will help you also, so that we can help future persons that are undergoing this. Okay, I think I'm not sure if my wife is going through menopause, but she eats PPAR tablets every day. So no severe. My wife is turning 50 next year. She's 49 this year, so around that time. So there were a few times she thought she was going menopausal, then the menses came back. Okay, so but anyway, yeah, she doesn't have all the. She experiences some, but nothing bad, nothing severe. Nothing severe. Very mild. Everything's very mild.
Even her mood is really good as well.
Yeah. I try to believe it's because I'm a good husband, but it might be the PPAR tablets.
Could be. Thank you.
Good evening, Janet.
Yeah. Hello, Ma'am Jaslyn also.
Yeah. Oh, she's on. My wife is on.
No. I'm just doing a shout out
Okay.
so that she watches this
Yeah.
live.
All right.
All right, so for our next question, okay, it's interesting. You've mentioned something about mental disorder earlier. It's different. So, coming from Mr. Marcus, could PPAR nutraceuticals have a role in slowing neurodegenerative diseases like Parkinson's or Alzheimer's?
Absolutely. Very, very good question, right? This is one area I'm very interested in exploring. In fact, I'm looking at a few products right now that could potentially resist development of dementia and Alzheimer's. I'm 51, so one of the things that I'm most afraid of is losing my mind, right? Okay. So yes, the answer is yes. Yes. Why? Personal experience. My father-in-law or my wife's dad is a Parkinson's patient. Okay, so at the height of his Parkinson's, we were giving him 1 PPAR liquid every single day. Okay, every single day. So what did we see? Why did we start to give him the liquid? So we started with extract powder, then we moved to liquid, because there was a point where he was shaking more. All right. So that's when the Parkinson's is getting worse. So we decided to go to liquid. Yes, it is expensive. Yes, I'm able to do it, I guess, more easily than the viewers because we produced the thing, right? But I just want to tell you the outcome. The outcome was the shaking diminished, all right? And my father-in-law maintained a healthy appetite throughout his time with us. My wife is not here, so I forgot the actual time period, but it was a few years of Parkinson's, right? So he was able to walk, right? Then after that wheelchair, but he was always fit, all right? He wasn't shaking like that, okay? If he needed to stand, he could eat. So this part was very important, that he could eat. Yes, towards the end, he was like more like, just staring ahead. He couldn't really speak much. But overall, it seemed to help him manage his Parkinson's well. And of course, he left us to join the Lord in his sleep. Okay, so from a first-hand experience, yeah, I believe I can see the effect it had on my father-in-law. It didn't cure the Parkinson's, definitely. It improved his quality of life significantly. Okay, now let's talk about the mechanism. How do we think that that helped? Number one is definitely still neural inflammation. We know one mechanism is the neural inflammation. So recently, as I study about the Parkinson's and dementia, I've been speaking to some researchers, professors, and they highlighted something. Why a lot of brain disorders are hard to treat is because of the BBM, blood-brain membrane. So there's actually a protective membrane. Okay, membrane is like a thin layer, right? Like a saran wrap. Okay, there's a membrane that protects your brain. It stops drugs or anything that is not supposed, any chemical compounds not supposed to go up into your brain to go into your brain. So for example, if you take drugs, it goes into your bloodstream, but it cannot enter your brain. There's actually a membrane, a saran wrap, that prevents the drugs from entering into your brain area. It is in your bloodstream, but it gets stopped when it tries to enter the top part where the blood goes to the brain. All right, this is to protect the brain because our brain is so important. So the brain chemistry is also very important. So it will like filter out things that will affect the brain chemistry. So this is one of the challenges when they treat brain disorders like Alzheimer's, Parkinson's. The type of drugs that can actually penetrate the brain, blood-brain membrane, tend to have very negative side effects. All right, so we haven't done a specific study on this. So my suspicion is that the nutrients in the PPARS, right, is able to cross the blood-brain membrane and help patients. At the very least, the neural inflammation part. So again, we had another experience. This one is with a schizophrenia patient. So what I'm sharing with you is my personal one, right? Because not every one of our doctors can share their client conditions with us for privacy reasons, right? So these are the ones I personally dealt with. So there is a Philippine client who had schizophrenia, and I was requested to go to Medical City, the one in Ortigas, right, to meet a psychiatrist. Why? Because the patient is warded into the hospital. He had a schizophrenia incident. So that means he was having his hallucinations. So the mother really didn't want to feed the son the psychotropic drugs because to calm him down, because he's hallucinating, right? To calm him down, normally they give drugs to deaden him. Then he will become like a zombie, right? He'll be zombified. Yes, it works to calm him down, but it's not good, right? It leaves him like a walking zombie. So she wanted to try something natural. So at the time, Dr. Alhambra, who was a pediatric neurologist, very top pediatric neurologist who returned from the US, wanted to try our soft gel capsules on this particular patient. Okay, so I was requested to join her to support her. Since I am the PPAR expert, right, I will explain more about the product specs. So we were there talking to the psychiatrist, and the psychiatrist felt comfortable that, okay, there's nothing harmful or dangerous about this supplement. Of course, she didn't believe that the supplement could help, but she was just there to make sure that it's nothing harmful, or else the hospital will be irresponsible. Okay, so what happened is that, okay, the patient took two soft gel capsules, I think twice a day. Calmed down, didn't have to take the psychotropic drugs. So normally they give them like tranquilizers, something like that, right? So didn't have to, he was able to calm down and talk normally. So as he calmed down, he can still talk. Normally if he take the drugs, he calmed down, he's a zombie. All right, so I asked Dr. Alhambra, what made you think? Because, like, again, we always talk on our program, we say PPARS is for cancer, it's an immune system. So all these, we understand how it strengthens the immune system, how it protects against cytotoxicity from chemotherapy drugs, how it helps the bone marrow to produce red blood cell count. We understand all that. We didn't do any research on the brain disorders. So I didn't know what mechanism, right? It's just that we saw, oh, wow, we saw the results. You may not understand how it works, but the important thing is you saw it works, right? So, and it's natural, so there's no harm, all right? And then on the other side, it will help with the patient's blood cholesterol, blood sugar, and inflammation in general. So no harm taking, but wow, it worked, okay? So I asked Dr. Alhambra, what made you think to try to use our Simply Nature extracts, the soft gel capsule? She said, I did a research on your product's mechanism. So I saw the modulating of the inflammation part, and neural inflammation is always a very important part on any brain disorders, right? So whether you're depressed, hallucinating like schizophrenia, split personality, multiple personalities, depression, manic, that means anxiety attacks, all this, right? Neural inflammation is one factor. It's always a factor in all these brain disorders. So if you can improve the neural inflammation part, you can't cure the brain disorder, but you can manage the brain disorder. That means you will help the condition of the patient, right? So that's why she tried the product, and yes, it worked. Hey, you're muted, Sheila.
Okay, there. So could it be the same mechanism for kids with autism?
Yeah, correct. Autism also, you're absolutely right. I have two friends whose children are autistic, and both of them is their sons. Okay, so they took the tablets. All right, they took the tablets daily. All right, so did it cure the autism? The answer is no, it did not. All right, it did not cure the autism. What it did was help the child calm down. So I'm back in Singapore, but I have to remind myself the next trip I go back, I want to look up for pediatrics who specialize in the treatment of autistic children. I know a very good doctor who really loves autistic children and has great success with them. So one of the things he does is he has a lot of other protocols, like for example, stimulating the part of the brain with electrodes, not electrocution, okay, just gentle. That means that there's no pain or anything. And then nutrition. So what I found out was that his improvement is like the kids see good improvement in like 6 months to a year. So it takes some time. And this is where I said, wow, but the soft gel capsule for those people with brain disorders taking our product, the effect is 24 hours, right? It didn't take 6 months. So I'm very keen to find out what if we combine his protocols and use the Simply Nature PPARS to quicken the whole process, right? So yeah, this, like I said, there are many things that the product is amazing for. We're just beginning to understand. Another area is CKD, kidney failure patients. We're looking into that this year as well. Yeah. So I hope that helps. Yes, Parkinson's can, right? It will be helpful if you are financially very, very strong, because then you can go for the liquid. So I have cancer patients who take 2 vials a day for 2 years. So you can imagine the financial strength. Definitely, if you're financially strong, then go for the liquid. If you are not, then you can try. I would still say you can really if you really want, you can try the liquid, right? To see if, especially if the patient is like serious, like for example, really, really shaking. So if you try the liquid, then if the shake reduce, then you straight away know, wow, Meron effect, diba? So again, it's not going to cure the Parkinson's. Its main goal is quality of life. So you take a look at, you have to balance the effect and versus the cost, the financial part, right? So if money is not an issue, then yeah, go for the liquid. If money is an issue, you might want to just try the liquid so that you know, oh wow, if if trying the liquid, the shakes, right, reduce. So you know the product is good for the patient. Now the question is, then you just decide which level can you financially sustain. You may not have the same effect, but at least you know now you have found something that's good for the patient that perhaps will help slow down the progress of the Parkinson's or at least give quality of life. Again, it's going to help with the blood cholesterol, inflammation, and of course, blood sugar management. All right. So most patients who develop things like Parkinson's also have metabolic syndromes because all these are contributing factors. All right. So getting those under control. Yeah. So if it works with the liquid, you can move down to soft gel capsules or tablets if it's financial. But at least with the liquid, then if it improves, you know this product range works for the patient. Okay.
Yeah. Actually, sir, just very quickly, I just want to say, sometimes it's really not the solution to the main problem, but
Yeah.
the ability of the supplement to taper off some medication that would really help not to progress into CKD or any liver problem.
Yeah, you're right. You're right. Because
Continue taking
one
of
issue,
them.
if another illness develops, then it's even more problematic. Right? Yeah.
Thank you, sir. All right. So for our next question, okay. Coming from Mr. Noah, can PPARS reduce chronic pain caused by inflammation like pelvic pain, arthritis, and fibromyalgia?
Okay. Short answer is yes. Long answer, it's not as effective as a painkiller. Okay. So if you want like immediate, profound pain relief, acupuncture will work. But again, pain relief is for these causes that you say are all going to be temporary. Why? Because you relieve the inflammation, the pain, that it's going to come back. The inflammation will build back again, right? So it's something that you have to constantly go for. All right. So if you go for regular acupuncturists, that can help you manage pain tremendously. Then again, it's really case-to-case basis. I'll give you an example. I used to have a lot of neck aches, right? So no matter how I sleep, change my position, I still easily develop neck aches. So I like I told everyone, I study TCM. So when I was studying acupuncture point, I found a point for when I studied in my books during the lecture. This was a point for neck pains. I'm like, let's try. I poke myself. I treat myself. Okay. So the moment I insert the needle, within 5 seconds, my neck ache gone.
Wow.
And then I treated myself twice, so a total of 40 minutes, right? It's been 2.5 years. Yeah, I never have had neck aches ever since. So is acupuncture very effective for pain? Yes, it is. All right, but not every pain. So you can try. Right. Okay. Next, if your pain comes direct from inflammation, yes. It will. Why? It will deal with the root cause. It will actually help manage or improve your inflammation, right? So it will actually treat the illness at the root cause. So I give you an example. We have an OB-GYN, and she bought a lot of soft gel capsules, like 60 every time, 60 capsules, 60 blisters. That's a lot. Okay. So we thought that she was treating a lot of OB-GYN patients. No, it turns out she was treating only one patient, her sister. So she was buying for her sister, and we found out why. Her sister has very severe rheumatoid arthritis. Okay, so it's like your case, joint pains from inflammation. How serious is it? How serious was her sister's rheumatoid arthritis? It was so serious that they had to do direct injection into the joint every 6 months. Okay, just to manage the pain. So that's how bad it was. After the sister took the soft gel capsule, she has not had any more injections. Okay, and I thank you for asking this question. I will send a text to my our med rep team to go and ask this doctor, because she constantly bought that from us for about 2.5 years, right? A lot of soft gels every month, right? At first, we thought she bought so much, it must be for patients. No, it's for one patient. So apparently, her sister takes a lot of it. But after 2.5 years, I don't remember. I don't think she buys much anymore. So I will go and follow up, right? Because our products actually settle things at the root cause. So I just want to encourage all our viewers, right? Unlike conventional medicine, our product is not a maintenance drug. It's like a rehabilitation supplement. So if you watch your lifestyle and over a sufficiently long period of time, if you don't do the thing that got you the disease, that means you stop doing the thing that caused you to have your disease, it is actually possible to restore your body to a healthy state. So one possible reason why the doctors, that particular OB-GYN doesn't buy our soft gel that much anymore could be the fact that her sister has permanently improved to the point that even if she don't take our soft gel, she doesn't need to have injections into her joints anymore. All right, so maybe the level of pain that she has now is very manageable and she doesn't need to take the soft gels anymore. So I say this to help you understand how our product works. Our product works by actually correcting the actual issue that is in your body. So if it corrects the issue and you are able to maintain this for, let's say, 6 months, a year, 2 years. So after 2 years of your system being strengthened, guess what? It's back to normal. So even if you stop the product, you don't have to, your disease doesn't come back, right? So there are many people who got their blood sugar normalized, and even after they stop taking PPAR tablets, their blood sugar is still normal. Right? Literally, they have reversed their diabetes. Okay, so that is possible. But it takes time, right? It took you years to develop the diabetes. Please don't assume that you can reverse your diabetes in 3 months. You can normalize your blood sugar in 3 months, but if you stop taking the product, the sugar level will still come back. But if you are able to maintain your blood sugar with our PPARS, right, for like a year, 2 years, then even if you stop taking PPARS, it's a good chance that what's that called? That your condition is actually reversed. I think a good example will be like exercising. Okay, if you really exercise and strengthen, let's say an old injury, let's say you have a knee injury, right? Let's say your knee was very badly sprained or something, and it's very painful every time you walk. If you slowly rehabilitate your knee, right? You go for physical therapy, then after that you take walks, and then when your knee is strong enough to do walks, you actually slow jog, and then you actually go to the gym to do those knee exercises, lift weights with your knee and strengthen your knee. I tell you, after you do that for 2 years, even if you stop going to the gym, your knee is recovered. Right? You don't need to go to the gym anymore, and your knee is actually recovered, right? Because it's a slow process, but if you keep at it, right, it's not forever. Like after 1 year, 1.5 years, 2 years, your body actually gets strengthened enough. So that's one of the possibilities with our product, and I hope that's encouraging to the common questions today, the non-cancer questions that came. That's because that's how the product works, right? It will take time to strengthen your body, and of course you must take care of yourself. You don't do the opposite and develop another disease. Okay, yeah.
Yes, sir. But yeah, I just want to reiterate, when you are a person taking maintenance medication for a long time, you still have to continue on with monitoring.
Yeah. Please, don't drop your maintenance meds immediately, gradually, all right? So you take our product, you monitor your blood cholesterol, your blood sugar. Okay, it's really still very good. You slowly lower your maintenance meds, all right, until you don't need them anymore.
Tapering must be done by your doctors, definitely.
Yeah. Okay, it's very simple. It's like, you injure your knee, right? So when you go for physiotherapy, you take out the cast, right? You take out the brace. Normally you will do bandage. You bandage your knee to keep it strong, right? So when you go for physiotherapy, you take off the bandage and you exercise your knee. Then after that, you put the bandage back, right? You have to slowly strengthen your knee until you can remove the bandage, right? So it's the same way with your maintenance drugs, okay? Yeah.
Well, I think this will be our last question for tonight, Sir Sean. Okay.
All right.
Okay. Coming from Miss Sophia, Ethan. Now, how realistic is that? Is it that PPARS nutraceutical can slow progression of metastatic cancer? Metastatic cancer. So these definitely are the late stages.
Yeah, it can. Now, the reason why I cannot say it will and how much is because our product doesn't work on the cancer. Okay, to help everybody understand why I cannot give a definitive answer for questions like this, like how fast can Simply Nature PPAR liquid extract shrink the tumor? Right, this another question very similar to what you're actually it's the same as your question, because your tumors have the cancer has metastasized. So how fast can it shrink the tumors wherever they have gone in your body, right? Okay, so it's basically answering it. Because how come chemotherapy can say 8 cycles? Your tumor, if it works, your tumor should be gone in 8 cycles, for example. Why? Because the chemotherapy directly attacks the tumor. So the pharmaceutical company has done so much research, and over the last 20 years, doctors have monitored their patients. So they know a tumor that's 4 centimeters, right? If we use chemotherapy at this particular dosage, right, it will take how long for the chemotherapy to kill the tumor and shrink it, right? Why? The chemotherapy is working on the tumor, is attacking the tumor. So this is something they can measure, right? It affects directly the tumor. Okay, this is not how Simply Nature PPARS works. Okay, Simply Nature PPARS doesn't work on the cancer tumor. It works on your immune system, right? So let me share with you the direct way how it works on the immune system to fight cancer. Okay, so let's talk about fighting cancer directly. So how does your immune system fight the cancer? So the first part is your immune system must be able to detect the cancer. Okay, so a question is, why isn't my immune system detecting the cancer? This is the same reason why we need a flu vaccine. Can your immune system kill the flu? Yes. What does the vaccine do? The vaccine helps your immune system to recognize the flu virus. Once the immune system can recognize the flu virus, it can kill the flu virus, right? Another example is COVID-19. So if you remember all the education during the time of COVID-19, there were many education programs that explain how a vaccine works. A vaccine trains your body to recognize the virus by giving a virus that is the same but without any teeth. It's like you pull out all the teeth of the virus, then you put the virus in your body. It's now harmless, but it looks like it is the same virus without teeth. So you put that into your body for your immune system to recognize this virus. Once it recognizes this virus, when the virus with the teeth, all right, enter your body, it already recognizes the virus and it will go and kill the virus, right? So vaccines train your immune system to recognize the virus. So that is how Simply Nature PPARS helps to fight cancer, right? There is this particular part of your immune system called the dendritic cells. Their job is to detect cancer cells. Okay, not only cancer cells, but also bacteria and viruses, right? They are the scouts. They are the person that go around checking. They are the inspectors, okay? They are the inspectors of your body. So what does Simply Nature PPAR do? Simply Nature PPAR goes in and stimulates your body's inspectors to do their job. All right? So the issue is, how healthy is your inspector compared to my inspector? We don't know. So when the Simply Nature PPAR goes in, if my inspectors are college graduate inspectors, if your inspectors are college graduated from De La Salle and my body's inspectors are high school dropouts, if we both stimulate our inspectors, your inspectors will do a better job than mine. Okay, so that's why you seem to have a better result with the Simply Nature PPARS on your cancer, right? Because the Simply Nature PPARS actually work on your own immune system. So if your immune system is very strong and good or effective, then the product will work even better for you, right? So if your immune system is on a weaker side, because maybe you've been fighting diabetes for so many years, so your immune system also got weakened, then the effect of the PPARS is for you to fight cancer is slower. Not that it doesn't work, but it's slower. So because of the factor that we cannot control, right, since we are working on your immune system, the answer of how this can help with the metastatic cancer, it depends on patient to patient. Will it have an effect? The answer is definitely yes. How big is the effect and how fast can you see the result? That will really depend on patient to patient. So this is why Dr. Jansen would, if he was here, he would recommend the liquid. Why? Our liquid is our strongest. So you give the strongest boost, the strongest stimulation. So even if your immune system is a high school dropout, you give him so much help that even a high school dropout will do something, right? So that's why when it comes to cancer patients, we will usually start with the liquid, right? Why? We want to know straight away how effective the protocol is going to be for the patient. So we try the strongest with the liquid. If it works, then we manage based on financial requirements, right? If the liquid is not something you can sustain, then we move down to the powder and say, oh wow, it's still working. So your immune system is quite healthy. We just need this level of stimulation. It's gonna be effective for the cancer fighting. So the first time round, we are just checking whether the protocol will be effective in strengthening and stimulating your immune system to fight the cancer. Okay, yeah.
And that's the reason why we always give you a lot of options, because we are not only considering the health conditions, but also the budget.
I hope this is helpful to everyone. Yeah. Okay.
All right. Well, just before we say goodbye to our viewers tonight, I'd like to ask for a very quick parting words coming from you, Sir Shyan.
Okay. No, I just want to thank everyone for joining us today. Even though Dr. Jansen is not here, we had a healthy number of viewers. So that also is encouraging. And I think today's program is a bit different. We had time to chat, go a bit less medical, more on the mechanism part of the PPARS. I hope that has been useful for you guys to understand how PPARS actually works, and that it gives you the confidence that this could play an important role in how you fight whatever illness you have, from rheumatoid arthritis, from joint pains, all the way to Parkinson's, and of course our usual cancer. So with this, I look forward to seeing you guys again. Oh, I won't be seeing you guys next Thursday, right? I think it will just be It'll be Dr. Jansen and Jhen, all right? So today we have the cancer survivor mom and the PPAR expert. Next week, you're going to have the pharmacist and the doctor. So Jhen is a certified pharmacist, and Dr. Jansen, you all know him. So prepare all your very medical-oriented questions next week, all right? Dr. Jansen will be taking it. I will be able to join you guys next week, but we'll be both back together, Dr. Jansen and I, in the week after. So thank you very much. I'll hand the time back to Ciela.
Thank you so much, Sir Shyan. Okay, so once again, thank you for your questions, and thank you for considering our program as a program of value. While you journey with your own health battles on behalf of our patients. Thank you so much, Sir Shyan, for putting so much effort and care towards our questions tonight. Now, for everybody, if your loved one is battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. And keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, Dr. Jansen Calalan's Facebook page also, and Simply Health Medical Group, and subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and events. Now, support your health the natural way with Simply Nature PPARS because it's trusted by doctors and loved by families across Asia. Don't miss the chance to save big and stock up for your wellness journey because for a limited time only, while supplies last, you can buy 3 individual packs of Simply Nature PPARS soft gel capsules and get 1 pack of Simply Nature PPARS soft gel capsules for free. Guys, that is worth 3,700 pesos of products just for free. So please message right away your CSO or your assigned CSO right after this program. Now, because now more than ever, it's important to strengthen your family's immune system. Now, we hope to see you on our next webinars to come. That is happening on September 25, Thursday. And this is once again, same day, same time, every Thursday at 7:30 p.m. Your commitment to healing and recovery inspires us. And remember, every step that you take is a step forward and you don't have to walk this journey alone. We want to thank you for spending your time with us. Once again, this is Simply Healed webinar powered by Simply Nature International and Simply Healed Medical Group because your curiosity about your health conditions and your victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night and God bless you all. Bye.